Hello, South Florida and beyond, and welcome to the editor's desk. We're going to get right into it. Today, we're going to be talking with a local doctor, but not only about medicine. We'll start there, and then we'll talk about a little bit what's going on in our world and the world, and go from there. So, without further ado, I want to welcome Dr. Alan Patterson to the program. Dr. Patterson, how are you doing this afternoon?
I'm doing great. Thank you so much for having me on again.
Thank you for joining me on the editor's desk, another show here. So, yeah, let's get right back into it. You look like you sound great. You look, you're loud and clear. You look like you're back in the office. So, how have things been going? Because I know a lot of people are wondering if doctors are getting back into the swing of things, and it looks like that's happening.
I've always been in the office. We never close my office since I'm an essential provider. I need to stay open to take care of my obstetrical and gynecology patients, but we're doing everything to keep my office safe. We're wearing masks when we see the patients and gloves. All my patients must wear masks and they can only come by themselves for now. Hopefully, we'll be able to open that up in the future, but we're doing everything we can to try to stay safe and keep my patients safe so nobody contracts the virus. But I've always been open, and now I've added telehealth to my features. So some people, we can do a telehealth visit for certain GYN problems, and they don't have to come to the office necessarily. We're not set up for that for obstetrics because that's a whole other issue with equipment at home. Someday we will, but we've added the telehealth, which has been very good and working very well. And I can get into more of that later as you ask me questions, I'm sure.
Yeah, that's great. And we are going to get into that as well. The other thing that's going on this weekend, I've been all over your Twitter feed, which has grown in popularity big time in recent times. So, but one of the things you were talking about this week was National Nurses Day, and I know right now it's hashtag Nurses Week. It's very important. Great. You said great nursing care is essential to great patient care, and I know the two hospitals that you deliver at. You were, saying how you have such a respect for nurses, and I think the general public has a newfound respect for nurses, doctors, anyone working in healthcare. So, tell us a little bit about what nurses mean to you and why you were so excited to put that kind of info out.
Sure. I mean, nurses are essential. I mean, I'll start with my staff. I have a great office staff and a great office manager in my office. If I didn't have a great office staff, I wouldn't have a good office. So it's a team, it's teamwork. And so by working together, we give the patient the best care. And in the hospital, whether it's in the labor room, obstetrics, or other areas of the hospital, nursing is essential because I work closely with the nurses, and they're an essential part of our team giving the patient good care. So I appreciate everything our nurses are doing. They work very hard, sometimes long hours, sometimes extra hours. Sometimes they get called to come in when they don't want to, but they come in for the betterment of the patient and for the hospital. So I can't say enough about the great nursing uh, care I get at both my hospitals, West Boca Medical Center and Boca Raton Regional Hospital. It's essential to good care. And I love my nurses and I love my staff because it's if without them, I'm no good.
Yeah, that is great. And both of those hospitals are in the news today as I'm fighting off my cat that's behind the screen right here. I mean, this is the new way of doing things, right? We have
Exactly.
this guy is all over me. Chester, you finally got on the air. There you go.
Wow,
So we're doing things
he's a
from
good looking
home.
cat. Nice markings.
Yeah, thank you. He's an orange
Great
tabby,
cat.
Interesting thing I read about them that 85% of them are males orange tabby, which I have to make sure that is a scholarly article, because nowadays we get reading everything, and as a journalist we should check our sources. So that's kind of funny, but that's something for another day. The two hospitals you mentioned,
Yeah.
though, the reason I know that is funny. Reason I'm mentioning it because at 1 o'clock today, as I was sitting down to eat lunch with my daughter and my wife here in the living room where I've been my office for the last 8 weeks, I hear this roar above us, and I had read that the Blue Angels were going to be doing a flyover of Boca Regional Hospital and West Boca Medical Center today as a thank you to healthcare workers. And sure enough, they must have came up here to Boynton Beach to turn around and get a good run at Boca Regional because they went right over my house. And I went out, and
Well,
there they went.
that's awesome. We barely caught a glimpse of my office, but my daughter got a nice picture of them from our house in Boca, and one of my patients got a great video. So a lot of people saw them. So that was a great tribute for them to pay tribute to all the healthcare workers who are working so hard during this trying times. And we will get through this, and things will get better. But people just have to use common sense, social distancing, wearing masks, and vaccines will be coming out that are safe. And once they are tested, I know I'm going to be getting the vaccine. That's going to be a personal choice, but that's going to be key in this fight against this virus. But for now, we all must do what we can do. And that was a great tribute for the tremendous Blue Angels to fly over Boca and both hospitals today.
Yeah, and you're wearing their colors. You got the blue and yellow for your Indiana Pacers, is the same as the Blue Angels.
Exactly. Exactly.
It's a
And hopefully we'll
it's a
have
timely
NFL
interview.
football. Yes.
Yeah, I saw the Dolphins schedule already. I already looked at it, so I'm sure you checked the cold schedule out as well. Hopefully,
Oh,
we'll
yeah.
we'll be on schedule.
Yes,
So that's
hopefully. You
great.
never know. I mean, we have to go with the flow, and it is what it is, but things will eventually get back to being better. So everybody just must hang in there and do what they can do and do the proper things now at the proper time to prevent the spread of the virus.
Yeah, that is right. So one of the things you're doing is telehealth, and we started off there. Tell us what kind of services you can offer with telehealth, because I know it's a lot, but it's not everything, like you were saying.
Right. I mean, some things my obstetrical patients need to come for their visits. We're not set up for telehealth for that. Eventually we may, but for to do obstetrical telehealth, the patient has to be able to have fetal monitoring and blood pressure things in their house. But right now we're doing it for gynecology. Many gynecology issues can be taken care of with telehealth, such as minor issues if you have some pain or birth control issues or bladder infection, vaginal infections, a lot of things we can do over a telehealth visit. That's where my patient downloads a free app. It doesn't cost them to download the app. I'm connected with telehealth through my electronic medical records, Athena. So we talk to each other online like you and me are talking, and I can diagnose their problem and I can e-scribe medicine to the pharmacy, and I document everything in the electronic medical records, so the patient can do this from the convenience of their home, or if they are working, they don't have to leave work to come to the doctor's office, as more insurances want people to do this when we can. And if you have insurance, almost every major insurance, not everyone, but almost everyone, is billed through your insurance. So it's billed the same way as an office visit. So telehealth is the future of medicine, which I'm always going to keep even after this virus issue is over, because I'm going to be offering my patients the best of both worlds. The people that need to come into the office, we will see them in a safe environment, but many visits can be done with telehealth. And this is something that everybody's doctor should be incorporating into their practice. I'm glad I did it. I really should have done it a while ago, but this virus gave us the impetus to do it, and I was set up through our great management team. So it's working really well. I just did a telehealth visit today and it went great.
Yeah, I know you jumped right on it, and I was watching you share all the information on Twitter, which I'm gonna give out your Twitter. It's at Alan Patterson MD, because it is a great follow. And then I was interested to see the amount of different ailments. I guess you can get a lot of information just by, you're a doctor, so you know how to get the information you need from a patient. So it's easy like this.
Right. You have to ask the right questions. And then the thing with telehealth is, a lot of times you can diagnose and treat things, but if they don't get better, then you have to come to the office. Also, I have a lot of good information on my Facebook page that actually has a lot more information than Twitter, and my great website. So I would like anybody that is interested to go to my office Facebook page or my office web page, because that actually has a lot more information than my Twitter site, and my Twitter site is more for just medicine. So the medicine part of it is office Facebook and my office web page. But an example is somebody has a urinary tract infection, which is a bladder infection. I can talk to the patient, make sure you're not allergic to anything. I can e-scribe a medicine. If it doesn't get better, then we know the medicine isn't working and they have to come in and give a urine sample. But if so, we can send it out to make sure it's see what antibiotic you can use. But if your symptoms go away with the antibiotic, that means it works. So it saves you a visit to the office. So it's convenient. And even when people get back to work, it's the middle of your day, you have a minor problem. We could set up a telehealth visit instead of interrupting your day, drive to my office, interrupting the work schedule. And more employers want their employees to use telehealth for minor things or like a bronchitis or, sore throat or something like that. There's GYN. I deal with the GYN issues, but there's many non-GYN issues that can be treated telehealth. So almost everybody's doctor should be incorporating this into their practice because this is a benefit for my patients and my practice. And we want to make practice the best medicine we can and the most cost-effective medicine that we can do. And telehealth is part of that for the future forever.
And that website is obgynpatterson.com. So obgynpatterson.com. If you're looking for the
Correct.
Facebook page, you can just, Google Dr. Alan Patterson. It'll come up. I follow you, so I was able to do it. And I'm
Great.
not
Yeah,
that
no, because I
computer
post a lot
savvy.
of good information on a lot of posts on my Facebook page, and my web page has tons of information about all kinds of topics. You can book appointments through my website, see my reviews, see our past radio shows on my website, and my
Oh, thank
TV
you.
interviews on my website. So you're on my website also.
Oh, I appreciate it. Yeah, the past interviews. I think this is our sixth time in 5 years. I think you're my leader in the clubhouse right now. Dr. Nils Mueller is right behind you, I think, at 5, but you just took the lead today, so you got a one-shot lead. So we'll
Thank you.
keep you up at the
I want
top.
to say I'll come on anytime you need me to come on and talk about any topic that I'm versed in.
That's great. And I'm not going to ask you all about these, but people can go on the website. But some of the things that Dr. Patterson offers for telehealth, and correct me if I'm wrong, but I'll list them out really quick. For yeast infections, UTIs, birth control consults, vaginitis, which are vaginal infections, hormone replacement therapy consults, premenopause, menopause. I'm not going to say this right, probably. Amenorrhea, abnormal periods. So there's a
Amenorrhea.
lot of different things. Oh, I was close.
Right.
But
No, you were good. No, because if we can
so
do it, we'll do it. If we can't do it, we'll tell you. So we're trying to do more and more with telehealth, and it's working out very well. So it's convenient for the patient. But my office is always open if somebody needs to come into the office. And obviously, I'm still doing my deliveries every month at West Boca Medical Center and Boca Regional. So I have people that are due every month, and now I'm booking people in January. So my new ones are coming in now that are due in January. So I have people due every month, and the hospitals are doing everything they can to keep everything safe. So it's a nice, safe, clean environment. So people shouldn't be scared to go to the hospital and deliver because you definitely want to deliver in a good hospital. You do not want to deliver at home. That's a bad mistake. Please don't do that.
Okay, thanks for that info. And yeah, as hospitals are starting to get back to normalcy, we know doctors' offices are gonna, and we're all gonna get back to a little bit of normalcy. So doctors have always and healthcare have always been, about safety and sanitization and everything. So no reason to be scared there. And another thing, going back to telehealth, the last thing about it, if people don't have insurance, you're even offering a one-time self-pay, so that there's no reason if
Oh,
people need care
people,
why they
yeah,
can't.
we can do a self-pay price anytime, or if somebody needs follow-up, we give a nice discounted self-pay. So if somebody does have insurance and their doctor does telehealth, I'm sure they can give them a discounted price, a nice price, which would be usually cheaper than having to come to the office. So yes, whether you have insurance or don't have insurance, we can do telehealth visits for my patients or any new patients that have a problem. We can establish you as a patient, and then I become your doctor through the telehealth and treat you accordingly.
That is great news. Again, it's Dr. Alan Patterson, obgynpatterson.com. Find him on Facebook. Follow him on Facebook and Twitter if you like. Twitter is a little different, but he's got a ton of health information on Facebook. You've delivered over 5,700 babies, Dr. Patterson. You recently shared interesting news on and correct me if I'm wrong, the Cervidil induction, which is FDA approved for inducing 39 weeks and above. Tell us a little bit about that.
Yes, I mean, Cervidil, yeah. I mean, elective inductions or inductions for problems can be done before 39 weeks, but Cervidil is a FDA approved ripening agent. It is very safe to use. It's a prostaglandins on, and it's on a little piece of cloth on a string that is inserted into the cervix, into the vagina right next to the cervix. And the chemicals in the Cervidil ripen up the cervix, so it makes an induction much easier. Sometimes a Cervidil can put the patient into labor. So there's many reasons why people may need to get induced, but by using Cervidil and Pitocin and rupture of membranes, that puts everybody into labor. It doesn't guarantee you're going to have a vaginal delivery, but a lot of times by a safe induction can prevent many problems from happening or the baby having an issue if you would have waited and not induced. So safe induction prevents C-sections. It doesn't cause C-sections. By waiting for nature to take its course, which sometimes nature doesn't work right, then sometimes that can cause a problem. So Cervidil is a great thing for induction of labor and it's FDA approved. And this numerous studies have shown the ideal time for you to have your baby is between 39 and 40 weeks. Anytime after 37 weeks is term, we don't stop you, but that's the ideal time for the baby to come out. 39 to 40 weeks. Once you go past your due date, more problems can happen, and problems could have been avoided by a safe induction. So, Mother Nature doesn't always work right. Mother Nature may not put you into labor. Sometimes we have to help Mother Nature, but we want a good outcome for mother and baby. And by using Cervidil and other methods by a board certified OBGYN experienced doctor like myself, will give my patients the best outcome they can have. And it's the correct thing to do based on everybody's situation. Everybody has an individual situation. So what works for your friend or what your friend's situation may not be your situation. So that should be between you and your doctor and not you and your friends.
That is great info, Dr. Patterson, once again, and FDA approved as well. Also, you also said resuming routine well woman gynecology exams. On April 29th, you were saying you urged women that are overdue to call the office for those types of exams and schedule an appointment. How often should a woman have that type of exam? Is it a once a year appointment or is it up to the doctor? How's that work?
Well, a well woman exam for a while, for about a month or so with the stay at home order, we didn't want to do routine stuff. We were just doing emergencies or problems, but now we can resume well woman exams. A well woman exam, almost every major insurance covers one well woman exam a year, so there's no copay or anything. A woman should have a well woman exam once a year. She may not need her pap smear once a year, but she still needs her breast exam and exam by the gynecologist because hopefully there are no problems. But many people come and we maybe the patient's having a problem and then we discuss it at the well woman exam that they hadn't discussed it, or I pick up a problem. So a well woman exam should be done once a year. A pap smear may not need to be done every year, depending on the patient's situation and guidelines. Sometimes that can be done every 1 to 3 years, but the well woman exam should be done once a year for your health. And often that times that leads to workup of other problems that maybe needed to be discussed, or maybe I discover something at the well woman exam that was not normal. So if my patient had to come in, that would have been missed, or it could have turned into a larger problem.
Yeah, it's great to see doctors, whenever you're scheduled because they find things. Preventive medicine is the key, in being healthy. We've discussed that on the shows for like 5 years, just on my shows, but that's been known to doctors for a long time. So definitely, make the call now. Things are opening up. Dr. Patterson said the word resuming a few times just today. They now announced in Palm Beach County that beaches are going to resume being open on May 18th, so that's good news. I know, Dr. Patterson, you early on were able to get up a little north of here where there's not as many cases and play golf because you have a friend in an area that had very low amount of cases that was able to get you on the course. And then I want you to talk about that. But first, also, you were able to get on the golf courses here recently in Palm Beach County when they opened up, and you look really healthy. You definitely got some great vitamin D, from the sun, whatever we're getting from the sun, and it was good to get out, right? So things are opening back up, and you've taken advantage of that.
Yes, I mean everybody should take advantage of things opening back up because it's good to get outside. It's good to do what you like to do, whether it's gardening, playing singles tennis. I know where I live, they opened up singles tennis, not doubles. And golf is a great game for social distancing because everybody has their own cart, no two in a cart, no rakes in the trap, no touching the pin. So the golf courses are sterilizing the carts and cleaning the carts, so golf obviously is, I love golf. I mean, I'm good at it. It's the one game you can be good at when you're older. And my good friend Ken Duke was nice enough to invite me to the Floridian a few weeks ago before they were open here. But golf is a great game because I love golf and you can do social distancing with golf and you're outside. And as other things open up outside, I encourage people, obviously, they're tired of being cooped up, to get outside, enjoy yourself, be safe, do what you're supposed to do. And with the golf, we've made a few adjustments, which is fine because I'm just happy to play and I don't mind doing the adjustments to keep everybody safe because we still must be safe because we're not over this virus yet. Social distancing, and when you're going to the store, please wear a mask if you can, gloves, but everybody should be wearing a mask when you go to the grocery store or whatever. There's absolutely no reason not to. You're not going to have to do it forever, but we all must do what we can do to try to prevent and not let the virus spread or not have a relapse and have more cases when they're starting to go down. It's very important.
Yeah, that is, and thank you for sharing that. And I was a little concerned early on about getting masks because I'm not in the well, I'm in the medical field, but I've been working from home. I actually took a week off of vacation before this thing hit, so when I came back from work, I couldn't come back. I've been working from home for the last 7 weeks. But what I'm getting to is since then, I've been able to obtain myself 6 different masks. So people, if you're going to grab takeout, I know I got Chinese food last night. They had a little takeout window, and put the mask on when I got up close and the glove on, and they had it as well. So there's little things that we can do over the next few months, and then still get back to our normalcy in life, like you said, getting out and playing golf and social distancing.
Yeah, of course. And now, yeah, at first it was hard for the average person to get masks, but now everybody should be able to get a mask. And you want to try to enjoy yourself. And that's just one example. You getting Chinese takeout. I mean, you're not eating at the restaurant, but you're still eating restaurant food, which is, which is nice to not have to make your own food every night. So slowly but surely, we'll be getting back to more normalcy. So for now, we just have to do what we have to do, and everybody has to we're all in this together. It doesn't do any good to finger point about whose fault it was or where it started. We should look at the now and move forward and not look at the past and criticize certain people, which I won't get into that because that's not the purpose of this discussion, but to look forward and do what we can do. And more drugs are coming out to treat people, and they're working on the vaccine at record pace. So, that's going to be a personal decision. But when I know the vaccine is safe, I'm going to be one of the first ones to get it because I do not want to get the virus. And if the vaccine will keep me safe and I haven't gotten the virus by then, I'm definitely going to get it because I'm going to continue to see my patients and give my patients a great obstetrical and gynecological care. I've been giving them since 1983 in first in Indianapolis and 1991 in South Florida. So everybody needs to do what they can do, and we will get through this. Things will get better. We just all have to work together.
Yeah, and I'll piggyback on that. Yeah, I've been cooking a lot at home. We've been ordering. I haven't been in a grocery store actually in over a month. We've been ordering through all those delivery apps, which like telehealth started. Like I didn't ever use telehealth. Now I'm using that. I'm using the delivery apps. So I've done everything. It's just once in a while when we don't want to cook, we support our local mom and pop. We got the mom and pop Chinatown over here. We go to the Danny's Pizza over here in Boynton as well. They have a pickup window. You just drive up. It's an old bank. So like yeah, once in a while we do that, and we just do the little things as well. And to piggyback also on the vaccine, I get a flu shot every year. So if they put a vaccine out, I'm definitely getting one as well. I'll just put that out there. But you said it's everyone's choice, but I've always been pro vaccines because I know a lot of the boards, suggest them as well. So that's just me.
True. I mean,
Everyone's.
yeah, it's a personal decision. I get my flu shot every year because I don't want, at my age, I don't want to get sick with the flu. And I'm a vaccine person, but you can't force somebody to do it. We all must have to make our personal decisions. But you want to try to protect yourself as much as you can going forward. So that's, that's going to be everybody's decision. But right, you want to try to get back to normalcy. And like there's a restaurant here in Coral Springs, Pepperoni Grill. They have great food. So the drug reps have, instead of bringing the lunch, they order from the restaurant. And that's a really good restaurant that we like to support because their food is excellent. So I encourage everybody to support their restaurants because times are tough. You want them to stay in business. I want everybody to try to stay in business. I feel bad for the people that can't work now or are out of business. I'm very fortunate that my business, I've been able to work through this whole thing, but we want to try to support everybody that we can and keep them in business and keep them happy because I think we're all in this together.
Yeah, I agree totally. And at the beginning of this, I was a little concerned because I have a young one and a family, and I've actually been a little busier than I've been in the past with this, which is a little different. But I still pray for the people that have lost their jobs, and I know everything will get back to a bit of normalcy as long as everyone just takes the time and level out, and then let's see what we can do to stop the spread of this. I wanted to also ask you. So we're ripping through a lot of questions, and it looks like we still have some more time, so that's good. As a doctor, I mean, you studied a lot of diseases through, medical school, etc. Did you ever think we would face a pandemic like this in our lifetime in the U.S.? Did you ever see anything like this coming? I know in the past, a couple years ago, there was the Ebola coming out of Africa. I think it made it to Texas and then never really spread. But did you ever see anything like this coming, or what was your
Obviously,
first kind of take
I
on this?
didn't. Some people might have said they could predict it, but I didn't. But it is what it is. So there will be lessons learned from this to prevent future things from happening or future things from spreading. So there will be many lessons learned from this that we will take going forward to be able to give everybody better care and also to prevent things. Obviously, prevention is the key. So lessons learned from this will be preventive lessons and being less dependent on certain countries for goods or whatever will come out of this. And we must learn our lessons from this and move forward because this may not be the last thing we see in our lifetime. So when something else happens in the future, we will have learned lessons from this and be able to react better and quicker and do more things. And it's a learning experience. So you learn from mistakes or you learn from experience, and you don't let the same thing happen again. That happens in medicine. I'm much more experienced than I was when I first got out. So I've learned things throughout the years to try to avoid problems or to try to prevent problems. And it's helped me with my medical treatment of my patients. The same thing with this going forward. So we must all learn from this, work together, and do what we need to do to prevent future outbreaks or treat them very rapidly and prevent the spread in the future and work on medicines that can work for multiple viruses or things that we already have them in place.
Yeah, that seems to be the theme of this interview. We learned about telehealth. We learned again about all the great care that you provide, and we learned that we can get back to normal a little bit and still flatten the curve by just doing a few small things. I mean, it's not like one thing one person's going to do. We're all kind of working together. We kind of shut this down, and now we're gonna reopen it. So I think that is a really great thing that we've got going here. The keyword is learn. So again, we're here with Dr. Alan Patterson. The website is obgynpatterson.com. It's Patterson, Patterson.com, or you can just Google his name. There's a ton of info. You're at your office in Coral Springs, right? But you cover the Boca area as well.
Right. I mean, my office is in Wiles Road. I used to have a secondary office in Boca, but I no longer have that. So my main office is Wiles Road, but I'm actually on staff of Boca Regional and West Boca Medical Center because those are the two hospitals I've always been on at, which are not far away. So I treat patients from, all the way from Miami up to Palm Beach. And so I have patients from all those areas that come to my office. And now with the telehealth, some of those patients that live farther away, I'll be able to give them better care because they won't necessarily have to come to the office for certain GYN problems. So my patients live in Miami or a new patient lives in Miami, we can establish them as a patient or in West Palm Beach or the whole South Florida area. And I can do a telehealth visit and establish you as my patient through telehealth. And then when you need your yearly exam once a year, you can come to the office. But for many other problems, we can do through telehealth, so you won't have to come to the office. That will save you time and convenience and make it much easier for you to get the great medical care from myself that you need and you deserve.
Well, thanks again. It's hard to believe we ripped through another 30 minutes, but love to have you on again, and thanks for supporting this new show. We'll get this out, and yeah, let's talk again in the near future, Dr. Pattison.
Thank you so much. You're definitely the best radio host in the United States. I appreciate you having me on.
Oh wow, thank you. I don't know about that, but I'll take it. But hey, it's something to keep striving for. I appreciate it. We'll talk next time. Again, thank you for taking the time out of your day. I know you're seeing patients in between. And yeah, again, it's obgynpatterson.com. Thanks again.
Everybody stay safe and we will get through this. Hang in there.
All right, thanks. And we'll see you next time on the editor's desk.